How do I understand BMD T-scores and Z-scores for osteoporosis? Imagine your bones as a bank account of calcium and minerals that keeps your body strong. When you get a bone mineral density test, the results are given as T-scores and Z-scores, which help tell you how healthy your bones are. These scores compare your bone density to different reference groups, giving you a clearer picture of your fracture risk and bone health. A T-score compares your bone density to that of a healthy young adult of the same sex, usually around age 30 when bones are at their strongest. The score is expressed in standard deviations from this peak bone mass. If your T-score is -1 point or higher, your bones are considered normal. If it falls between -1 and -2.5, it indicates osteopenia, which is low bone mass but not yet osteoporosis. When your T-score drops to -2.5 or lower, it means you have osteoporosis, which is a significant reduction in bone density and a higher chance of fractures. This measurement is mainly used for diagnosing osteoporosis in postmenopausal women and men over 50 because it shows how much bone has been lost compared to the ideal peak. Z-scores, on the other hand, compare your bone density to others of the same age, sex, ethnicity, and body size. This comparison accounts for the natural decline in bone density that happens with aging. If your Z-score is above -1.5 or sometimes -2 depending on guidelines, your bone density is typical for your age group. But if your Z-score is below these levels, it suggests your bones are weaker than expected for your age, which might mean there are other reasons for bone loss, such as medical conditions or medications. Z-scores are especially helpful for younger people, including children, teenagers, and premenopausal women, where comparing to peak bone mass is less relevant. Remember, a T-score tells you how your bones compare to a young healthy adult, which is useful for diagnosing osteoporosis in older adults. A Z-score shows how your bones compare to others your age and can help identify secondary causes of bone loss. Both scores are measured in standard deviations, so negative numbers mean lower bone density, while positive numbers mean higher than average. Keep in mind that having normal bone density does not mean you are completely free from fracture risk, and low scores should be looked at along with other health factors by your doctor. If your Z-score is low, your healthcare provider might suggest additional tests to find out if there are underlying issues causing your bone loss. Understanding your T-score and Z-score helps your doctor decide on the best way to manage your bone health and prevent fractures. Always talk with your healthcare professional about what your results mean for you personally, as they can interpret these scores in the context of your overall health, history, and risk factors.